Our next session is Are We There Yet? Finding Our Way to Normal from Ignite 360. And our presenter is Rob Volpe, CEO of Ignite 360. Rob, take it away.
Awesome. Thank you, Joe. And hi, everybody. Thank you so much for joining. And welcome to Are We There Yet? Finding Our Way to Normal. When I was writing this presentation, this was the image that was always in my mind. It's from The Simpsons, the kids in the back seat. They were on a road trip or vacation. The kids were going, are we there yet? Are we there yet? Are we there yet? And it feels like collectively, that's how everybody's feeling, and what we're trying to get to right now is where is normal and when are we going to get there? And of course, when I first started sketching this out a month ago, current events weren't quite where they were. Case counts weren't quite as high. Rescinding shelter in place and openness changes weren't going on, but it's still really appropriate because we are on a crazy journey. And it can get really tense, like when you have kids in the backseat of the car constantly asking, are we there yet? Are we there yet? So hi, everybody. I'm Rob Volpe. I'm the CEO of Ignite 360. We're an insights and strategy firm. I describe myself as an astute observer of life, as well as a master storyteller, and I'm coming to you live from my home office in San Francisco. A little bit quickly about Ignite 360, in case some of you are unfamiliar with the organization. I founded the company in 2011. We provide insights and strategy across a range of different industries and functions, from tech to CPG to financial services to healthcare. We are virtual by design, so that was a benefit when shelter in place happened. It was something we were already used to. We just got our wings clipped and couldn't travel as much or at all. But I am based here in San Francisco. We have people all over the country and then work all over the world on different projects. There's myself and a picture of my COO, Lisa Osborne. She is based in Seattle, but she actually just announced on social media yesterday that she is moving to Minneapolis next month. And then really excited, we were certified as a gay lesbian owned business by the National Gay Lesbian Chamber of Commerce. That was back in the fall. So we are officially a minority owned business for those companies that recognize the NGLCC certification. For today's presentation, three main areas that we're going to talk about. First, where are we today? What's going on? How are people feeling? How are they behaving? What's happening with masks and shopping behavior? Then we're going to get into the vacation destination. How are people thinking about holidays and where they might go and how they might get there? And then, of course, the million-dollar question is returning to in-person research. Are people ready for it? What are they looking for? What are those criteria? Because we have to think about it, whether you're on the client or the research partner side. And then also we need to be thinking about our respondents and what they're looking for. So we'll be sharing all of that, and then also talking a little bit more about where all of this is headed. I do want to point out there are people from a lot of industries and categories that are here today and really excited about that. So the learning is very general because I obviously couldn't tailor it for everybody like we would. So I want you to be thinking about, with these learnings, what they actually mean for your business and how you might actually apply them. And I will be available. I'll jump into the chat a minute or two after the presentation ends and try to answer any questions. And you can always reach me at our booth here at the conference. So all of the data that I'm sharing today is coming from our Navigating to a New Normal study. This is a weekly project we started at the beginning of April, following 16 people with weekly 1-hour IDIs. We have over 200 hours of interviews. I was just tallying that up yesterday. And we also pair it with a dynamic always-on quant tracker with 1,250 people, including a Spanish language augment, with data arriving on 1, 3, and 7-day basis. 1,250 people, that means it's over 16,000 responses so far, fully representative of US adults 18 plus, and partnered with a company over in the UK called Delineate, who is running a similar program over there with the same survey. Also, while I'm sharing learning out, I've got slides. I've also got video from our qualitative respondents. I've got amazing stories to share. Those videos, there's a total of 5. Each one is about 3 minutes. They all have subtitles, so even if you've got audio issues, you should hopefully be able to follow along. So when I first was presenting, we did a Quirks webinar 2 months ago, almost to the day, and we were talking about now, next, and future, and what was actually happening. And at that time, we talked about the pandemic being like the earthquake, really a sudden jolt, upsetting everything. And the recession was going to be this tsunami. You know, you have a major earthquake. If you know back to the 2004 Indonesian earthquake, tsunami happened, it upset the seabed, water rushed out, and then all of a sudden came back in, big tsunami that was even more devastating than the earthquake. And that's still what we believe is going to happen with the recession. And we will talk about whether people are feeling the recession or not. However, there's two new factors that have happened in the past 2 months. One is social injustice, the Black Lives Matter protests and the movement for racial equity. And the need for that and the added awareness. And then we are in a presidential election season. I'm sure all of you know that all too well. And that's also influencing. So there's actually a tug of war that's happening with all four of these things. And all four of them are informing how we're going to end up in our new normal. So as we're on this journey, we keep getting stuck on this roundabout, as I call it. So if you're from the Northeast, you know what I'm talking about. That circular intersection of different roads, and it's really hard to get off of and cut across the traffic. And here you can see some of the data from our study. Cases are climbing, and that includes worry for different ethnicities. Over here on the left, it's broken out by month. The red dotted line is just our running total from April 16th through July 12th. But you can see how in the Black community, concern is growing. With Hispanics, it's pretty much holding steady. And it's also actually grown with Asians, and then most recently with whites back up to April levels. Similarly, all of this is having a dampening impact on the economy. So this middle column here is looking at frequency of going out to eat once a week or more by US regions. And you can see how from mid-May to then our next check-in in mid-June, it definitely grew. But then now in the last 2 weeks, it started to come back down, or at least flatten, as cases are going up and people are continuing to get concerned. Additionally, there's worry about the financial impact of the pandemic. 1 year from now, the green represents personal concern, and then the blue is actually the worry about the country. And you can see where it's gone up from April and continuing. It looks like it's starting to inch up, and we're going to certainly continue to keep track of that and see what's going on. So now we're going to take a quick look at and listen to some of our respondents and hear how they are actually feeling right now. So let me change this over to our video, and we will get that going.
How would you describe your range of emotions lately, not necessarily in relation to the pandemic, but just in general?
Well, it has to be connected to the pandemic. It's a little disappointing how people have just rushed into things and assumed and thought that everything was going to be normal, and they just rushed back without being mindful still and understanding what this whole pandemic's about.
I'm honestly pretty tired. I'll probably go swimming today just to kind of get a little refreshed.
I think this last 2 weeks have not been, I think they've taken a turn for me, I think mentally too. It feels more negative for me.
What was do you recall like what that turning point was?
Like just the news, watching the news, like, cause I can't help it. Like I watch it every day cause I have nothing much to do. And like, so even though I'm like, I won't watch so much of it, I feel it's like when you see, and then I get like really frustrated that, I mean, people are just doing these crazy, irresponsible things. And I'm just like, and then it just then it seems hopeless because it's like, it's never going to end.
I'm kind of nervous about it. Like at first, I was like, oh, maybe it's a big hype. Like, knowing people that I work with that are testing positive. There's this one guy that worked on a line right across from me, and he's currently in ICU. You know what I'm saying? It makes it more realistic whenever you start knowing people who are in the hospital and they're like fighting for their life because of it.
I've gotten to the point where I'm done. I'm so sick of it. Somebody wake me up from this nightmare. Just done. You know, can't we all just get along? Because there is so much bullying about everything. And then when you go out in public now, you can actually see it because you're either wearing your mask or you're not.
I think I'm more anxious. It's just this heavy, deep anxious. Just constant behind the scenes because we're operating with this below the surface. It's like I'm not in control of this.
I'm very doubtful that we'll ever get back to what we used to call normal. I think the new normal is going to look a lot different. I don't think we'll ever be in a position to feel comfortable to give a hug to another person, do handshakes, socialize in crowded places like a nightclub or dance club or movie theater. I think the experience is going to be a lot different for a long time. But going into a packed movie theater, I just cringe right now.
So, are we really this stupid? I'm just like, we're dumb. Like, we don't deserve the responsibility and the freedom that we have. Like, we can't handle it. It is. It's like our parents like looked away for a second and we decided to throw a rager. Like,
yeah.
Which is.
So as you can see, there's definitely a lot of negativity right now. There's anxiety, there's concern. This is actually a big shift from what we were seeing and hearing from our folks just a couple of weeks ago. So as caseloads are going up and down, the mood of our respondents is doing the same thing. And part of this, as I mentioned, it's the earthquake. The earthquake shatters things. Plates get knocked down onto the ground. Right now, about 33% of our respondents in our quant study are indicating that they've had a serious or severe impact from the pandemic, and that's from late June through July 12th. But you can see here on the right the range of differences from whether you're a Democrat or you're a Republican, in the center or up at the top. How important is wearing a face mask? Do you consider it to be essential or unnecessary? Huge swing into how you think the pandemic is impacting you. And Joe might remember I talked 2 months ago about the urbanization and how that was impacting people. And urban areas, hotspots like New York, were definitely well above the national average. Suburbs typically tended to stay representative. And back then, 2 months ago, it was at about 36%. But rural areas were down in the teens. And now you're seeing rural areas climb up. And it's actually at about 26% of people indicating they've had a serious or severe impact. And that's reflective in what's happening with the virus. Additionally, over on the left-hand side, people that are having to work from home versus normally would work from home, feeling more of an impact. If your kids are suddenly with you, how much news are you watching? Ethnicity, if you're Hispanic or Black, you're reporting a more serious impact than whites. And even your mood, if you're feeling anxious or just are generally happy and feeling happy in the current days, it definitely has an impact on how you are feeling things. And so the hot topic is really around masks and who's wearing masks, and then also who's not wearing masks. So we've been asking people whether they should follow certain advice and then whether they actually are following advice. And here's a snapshot of what we've found. Across all states' total population, about 4% of people are saying it's unnecessary to follow the advice. But then when we ask them later in the survey if they are actually following the advice, 10% are admitting that they've not actually followed that advice themselves. And you can see that pattern of do what I say, not what I do, amongst younger folks, age 18 to 34, amongst people whose liberties, they would consider their liberties to be restricted during this current time, and then even people with an income under $45,000. There is definitely a disparity amongst whether you are following the advice that you are believing is essential and recommended. So let's take a look at shopping behavior and what's happening there. There's definitely been some shifts that are going on, and we want to take a quick peek at that.
Virginia has not had a spike like the countries in the states in the South.
Yeah.
But I have decided that I'm going to try to get more into shopping online. I got to make a plan about food, clothing, and necessities. I would rather shop online and not take that risk of, it's not spiked here, but I'm hoping it doesn't. But I just don't want to, you know. And part of it is, if you see anybody who's had COVID, the pain they have if they live.
Mm-hmm.
I don't like pain.
I don't really go to the store that much if I can help it. And like, even if we were to close down again, it's like the grocery stores would still be open. And before I was more afraid of the grocery store. And now that I realize I don't really have to be afraid of the grocery store if I'm careful.
In the beginning, I stocked a lot. And then by beginning of May, I slowed down, backed off. And I noticed that, I don't know, because of the holiday, I went back again in July, this week, and I started stocking up again. I don't know if it's something subconsciously that I'm doing because of what I'm hearing. Like, is there really going to be something bad happening?
How much food would you say you have on hand now compared to like 3 months ago?
A fully stocked fridge, pantry, every cabinet, and a survival tub.
Survival tub? What's that?
If power outages were to go out, right, I would have maybe like 2 months food supply in cans and drinks and stuff to eat off of.
Nothing has changed. I mean, go to the grocery, go to the pharmacy. We've gone to Home Depot a couple times because we needed stuff there. Other shopping, we've done none. I mean, it's Amazon. And is that going to change? No. I might, if I really start to run out of clothes where I'm recycling the same shirts and shorts over and over and over again, where it gets embarrassing, I will probably go up to maybe Macy's.
Yeah.
So I think there's a shift in my habits. I guess they're like less superficial, if you want to call it like. So like, it's like I'm no longer buying dresses and like pretty things. Like, you know, like I don't really need another like outfit to go out in because I'm not going out. So I'm buying more things that are like things to improve my home, or things that are like for my health, that are for like, you know, long-term investments, I guess, like for improvement of my home, and like for myself, like, you know, like I would go to Bloomingdale's and I would see like, oh, that's a really cute bag, like I want it or something. But now I'm not, it seems less important.
So yeah, that it seems less important, again, continued to come out, and you're seeing that shift. Some people are stocking up, some people are definitely shopping online, and a lot of people are realizing like, hey, I haven't got anywhere to go, I don't need new clothes, I don't have a reason to really use makeup, and so that's keeping things suppressed, and is going to continue that way while we keep having cases and people are hanging out. Another thing we've been checking in with people on is what summer vacation looks like. And it actually looks very different this year than last. You have probably also experienced this yourself with canceled plans or rearranging some plans. We're asking people about what they're thinking about doing and how they're actually thinking about getting there. Where's my mouse? There we go. So let me share that video on what people are thinking about getting onto planes, trains, automobiles, and hotels.
So earlier you said you were good with flights. Still good with flights?
Yeah, I think I am. Although American and another company, maybe United, announced that they're no longer socially distancing people, they're not my favorite airlines anyway. So I would do research on what the policy is of the airline as far as wearing a mask and what their seating policy is. And I would choose the least risky option.
You felt pretty comfortable flying when we talked about it. You were like,
I did. And then that changed. That changed because everyone's just like not doing what they're supposed to do.
Mm-hmm.
And if everyone was doing what they're supposed to do, last time we talked about this, and it got better, and if it progressively got better, then yes, I would probably still be going. But since it got worse, I'm not going at all. I'm not even thinking about traveling within this year at all.
how about hotels or flying? Where are you feeling about that right now?
No way. There's just too many variables. Hotels have never really felt super clean to me in the first place. Not that I'm totally persnickety and going and spray Lysol everywhere when I get there, but they don't feel that clean. And the airlines sitting in an enclosed space, no.
Where are you on traveling and doing anything?
Like, I do want to go somewhere. I think we're definitely going to do a trip in August, like with my mom and my dad. We're just going to do a road trip. Like, the thing is, I don't know where. The Northeast is just not fun. Like, I mean, it's, yeah, okay, you have like Cape Cod and like, I've been to Newport, which is nice, but like, I don't know, right. Maine, it's like, oh, yeah, I guess. But it's like, I'm not excited about it. You know, like when I travel, because I go to like nice places, like I get excited. I'm like, oh, the water, like I can't wait to go snorkeling. And like, this is like, the water is freaking cold to begin with. And it's like, you can't even see your feet. You know, like, and like when this whole thing started, I remember I was like so adamant that I was going to Japan. I'm like, I'm going, I don't care. Like, I'm still going. And my mom was like, why don't you look at like Florida and like, you know, the Key West is really nice for scuba diving. And I was like, I won't be caught dead in Florida. It's like, I will not go to Florida on my vacation. Like, it's not happening. And then as the time getting closer, I was like looking at Florida. Then I was looking at the Caribbean, and then things kept getting worse. And I was like, Florida, that's a great idea. And then it was like, it went from Florida like to the Carolinas. And now it's like not even that. So now we're back at like the Northeast, and just like, that's how bad things are.
What are the parts about traveling right now that worry you the most, that make you say, nope, not happening right now?
People. It's literally just people. It's nothing else. Everything is caused by people right now. Mm-hmm. So when you ask me like travel stuff, it's always going to be people now.
It's always going to be people now. And we actually saw that in our data as well, the quant data as well. Anytime people are in a constricted space with people, they're just like saying, no, not yet, not yet. And soon is defined here by next week, next month, and in the next 3 months. So, you know, looking into the early part of the fall, not getting on a plane, not taking in a cruise, hesitant about staying in a hotel even. And we actually asked, because Jennifer, who was in the interview that you saw about going to Japan, she was interested on this road trip she's going to take with her folks about staying in an Airbnb. They thought that would be the solve. So we actually found that only 13% are indicating soon for staying at a vacation rental. So there's something around trust, and it's trust in other people, but also trust in what the airlines are doing. You heard Brad at the beginning of the video talk about what American and United were doing, and he was going to have to do some of his own research before he got onto a plane. But overwhelmingly, the thing people would do is travel by car and go take the Great American Road Trip again. So the recession, as I mentioned, the water is out to sea. And so are we even feeling this at this point? Let's take a quick listen to that.
So what have you heard about this recession that we're having? I mean, I guess I haven't heard a lot about it other than like how it affects us. I mean, I guess you hear in the news, you know, obviously that like, you know, hearing from our haircut lady, like that was brought it home a little bit, like how much they've lost. And then she had just bought her building. And so it kind of put it into perspective, like how much these shutdowns are costing businesses, even if they're not open, you know, but for friends, like there are a lot of friends where it's affected them. I think it'll affect us later, just because of, you know, my husband's in construction. So they had jobs already bid and contracted to go back to, but there's not a whole lot of new bids coming out. Yep. So yeah, I think we'll see the effects of it later. Thankfully, we've gotten some one stimulus check to kind of cover some of those. So we've been really fortunate that it hasn't hit us yet. But I think ours is coming down the road because the government help has been there and the extra unemployment and, you know, the extra help to businesses. So I'm more worried when that goes away, I think it's not going to be good.
I'm trying to save my money.
Yeah.
I'm trying to make plans for the future. Right now, I really enjoy where I stay. I really do. I got one more year. I got a year lease on here now, starting August. But I'm thinking about going where the cost of living is less.
Mm-hmm.
So that's my solution for my life, that we don't know what the future is going to look like.
Because I mean that 600 extra is considerable, and I think it's part of the reason like I wasn't so worried. And then but then when you look at like another 6 months without that,
right,
and then and then it's like you still have like all the other expenses. Then it starts, and then the thing is, after those 6 months, like it's not going to pop right back to what it was. It's going to be a slow start. So you're looking at like a year really.
Yeah.
Until, like, when things, I mean, I love to think, and I think part of me like has convinced myself that like it's going to be right back to where, but I know better than that. And then like.
So yeah, they know it's coming. They're not feeling it quite yet. Something that the pandemic has enabled for people is the ability to actually pause and reflect. And that's actually something in our previous chapter, as we were talking about racism and the way people responded to George Floyd's murder and the effect on it. Gail, actually, who you saw here, she talked about how like the pandemic gave people the time because they were stuck at home and they didn't have a lot of other things to do. And you can see here in this, this is data from our quant survey on personal values and how these are people that have indicated they've actually taken action to do some of these things. And I would encourage you not to look at this as every individual, like don't go, oh, we've got to go have a gratitude strategy, but look at all of this in its totality and how much self-reflection is happening and self-care, looking after my mental health, finding time for myself, and even standing up for myself. So some really positive indications of some changes that are to come. So next, I promised you some data on focus groups. So let's hear from folks on how they're feeling about participating in in-person research. And this is my last video.
So what would it take for you to want to do something in person? Or what would you need to see to either be motivated or feel comfortable doing so?
Extra incentive.
Okay.
If they told me like, yeah, there's an extra $50 in it, I'm like, I'm there, you know. I got another email from a company. They said they're going to try to do one in the city in late July. In person, in the facility, all safety precautions are being taken and will ensure everyone stays safe and healthy. That's it. Oh, this is the best one. People with severe asthma. It's for people with severe asthma. No. That is so appropriate or inappropriate.
Wow.
I just put that together right now. That's hysterical. All safety precautions are being taken and will ensure everyone stays safe and healthy. If you had severe asthma, you should not be caught dead, no pun intended, in an enclosed space with strangers during a pandemic that is a pulmonary disease.
Would you get in there with 8 people with a mask on?
It's just not worth it to me. How's the circulation? I don't know the background of people that I'd be joining, you know? And I think it can just be done as effectively online through Zoom or, you know, WebEx or what have you, right now.
One more question about it. What if it was with a group of friends?
Easier, because at least I know how seriously they are taking it.
I love all my family members and friends, but I'm still going to put you 6 feet apart from me. I don't care what they say. You're still going to wear a mask around me, or you're not going to be around me at all. That's just easy as that. Doesn't matter who you are. It's just be safe.
I don't think I would be opposed if I knew like that like tables were going to be spaced and people were going to wear masks. Probably like instead of like if you've got like a normal 6-foot desk table, instead of 2 people at that table, like 1 person.
Well, I would hope the room was a fairly good size space, that there was some hope that the air would be moving, that people would be masked, that maybe there would be temperatures taken. You know, maybe there would be those kind of protocols, and certainly hand sanitizer and that kind of thing available.
So I think like what I've been hearing is that there are some places that are already open and doing focus groups. And I don't think people are wearing masks. What do you think of that?
The fact that these people still do it without hesitation is the crazy part. Like they'll really just go in, all right, I'm here for the money, really. But they don't think about their health later on when that really affects them. Was that $200 really worth your life being taken by a virus?
Was that $200 really worth your life being taken by the virus? I loved how Marco framed that up. We've just got a few more slides to bring this home. I know we're running slightly long, my apologies. So I wanted to share this. This is looking on the left, urban, and on the right, suburban areas. People's willingness to go to focus groups. The lines you want to look at are at the bottom. They're all under 10%, and you can see in urban areas, the red line, which is never don't intend to do this in the future, continuing to grow. Also, if you combine the red and the orange line, there's like a 60% part of the population that just doesn't want to do focus groups and in-person research. And I think there's actually something for the industry to start to explore and understand what those barriers are. And we're actually going to start diving into our own data to see if we can figure out what's happening. If you do feel the need, though, to do focus groups at this point in time or any sort of in-person research, really important to lead, not follow. Issue clear guidelines. People want to be wearing masks. They want to know about the hygiene, the cleaning, the space. Ventilation has come up consistently as we've been talking about this topic. Even exploring options to enjoy fresh air. Maybe when the summer heat breaks, are you able to do some socially distanced groups outdoors? Definitely make sure people know what you're doing, not only for them, but for your staff's safety. There's a lot of recognition of community spread, and your staff is part of that community. We were also hearing from folks about doing smaller group sizes and also even shorter time frames to minimize exposure risk. And then the big sort of aha that we had this week was around friendship recruits. People really opened up to that idea, you know, the invite friends that are just like you, because they know who those friends are and they know the precautions that they're going to take compared to strangers. So summing up, the big question, are we there yet? The answer is no. And the destination that we need to be looking for, though, is not where we came from. We need to be looking ahead because the destination is still over the horizon. And I found this particular piece of data really intriguing and compelling, and we're going to be unpacking it in our next chapter. But looking at the longer that the pandemic lasts, more new behaviors are going to become normal. And here we've got 72% of people saying that they would make changes compared to with how their life was before 2020. And then only 18% saying they want to get their life back exactly as it was before. So again, lots of self-reflection that's going on, and people thinking about how they want to make improvements in their life. And what that means for businesses and brands, we've got to be planning ahead. The pandemic, is not going away. The health experts are all saying mid-2021 or longer until a vaccine is widely available, which would be the indicator that we can start to gather the way we used to. The recession is still out there. I mean, the water just keeps pulling further and further and further back. It is all going to come crashing in at some point, and we need to be ready to manage that. New behaviors with consumers, they are definitely starting to firm up. We're seeing the sprouts of some seeds that were planted 3 months ago, and behaviors that are starting to change and that are starting to become the new normal. And there are further changes that are going to come down the pike as well, as classes are now, it's debatable whether those will be in person and online for students. Workplaces aren't going to be coming back together. A lot of large corporations are pushing off into 2021. So there are quite a few changes to go. So I know I ran a few minutes long. I apologize, but thank you so much for listening. You can visit our booth. I will jump into the chat right after this. You can also find chapters 1 through 5, these thought pieces, available for free on our website. Please reach out and connect with me. Those are our emails where you can reach me, and you can always find me on LinkedIn as well.
Great. Thanks so much, Rob. Great stuff as always. We've got one more session in today's lineup, and then afterwards it's a networking party hosted by Research Club. So see you back here after our very quick break. Thanks very, very much.
Awesome. Thank you, Joe.